What I find I really like about the LightForce laser is just the versatility of things it can treat. So if you go acute and chronic, it's got an application for both really. If we take an acute muscle injury, for example, in the early days where the player's quite painful, even when they're just walking, I find just the application of the LightForce laser has helped speed up that painful phase where they're finding themselves pain-free a little bit quicker. If we go even looking at more chronic conditions like a grumbly knee, say a degenerative knee, some of the players really like that as part of their daily warm-up or their daily treatment before training. They find it helps get them warmed up and ready to train a little bit better. We've even found it with tendons early on in pre-season when the players have come back, particularly after the break with COVID as well. A lot of the players have just a little grumbly tendons, and they find that that's just really helped their pain levels and their recoveries in terms of being able to train pain-free again. We had an interesting case a few weeks back with a player who was 6 months into his ACL rehabilitation. He had a bit of a setback where a seroma developed just over his fibular head, and the skin actually was breached by the seroma, leaving quite a big wound that resulted in a skin graft ultimately. But we were using the laser with the non-contact head on it daily, and pre-op and post-op, and found that it just really, the integrity of the graft and the look of the graft even is far beyond what the consultant even really expected when we went back for a review a few weeks later.
Yeah, I've had the LightForce laser used on my hamstrings before. It's a treatment that I thought helped me very much so in how I was feeling in my hamstrings, because I'd probably have it for about half hour before training sessions and before a match day to help, ease me and, help my muscles to be able to cope with the stresses of the game and the training sessions. I have had many treatments with it. I remember from last season when we first got introduced to the laser therapy, I had a problem with the bottom of my heel. And immediately as I used it, because I had like a numbing pain in it, so it sort of numbed the pain.
We had students in a few months ago, and one of their projects while they were here was to compare the laser therapy to other devices that we have here and other therapies we use. So they chose shockwave therapy at the time, and really what they did was they went around the players with a questionnaire and just got their thoughts on it, the treatments they'd had, why they'd had it, and their perceptions of the treatment and afterwards. And 90% of the players really preferred the laser. So when we dug a little bit deeper into that ourselves, it wasn't so much that they thought the laser was improving them more, even though it likely was. It was mostly the massage ball head and the feeling they got from the treatment rather than the shockwave, which can leave you a little bit uncomfortable. The head in particular, what they like about it is you get a little bit of a heating effect. They like that pressure and the compression. Most commonly, I think we use the laser with not even injuries, so just soreness after training or soreness after a match the previous day. Players like to come in and they just find that it just helps freshen them up, and things like tight calves, tight hamstrings, tight quads just really helps the muscle to relax, and as we know with the increase in energy production within the cells, they feel a lot better after it.